We have created this video to help you understand the skin problems you may encounter after having an organ transplant.
The drugs used to prevent rejection of your new organ have effects on the immune system, which means you have an increased risk of developing certain skin conditions.
These conditions can also be seen in people who have suppressed immune systems for other reasons. In this video, we will discuss some of the most common of these skin conditions. Acne-type spots are common in the first 12 to 18 months after transplantation. They usually affect the face and sometimes back and chest. They usually settle down as the doses of immunosuppressive drugs, especially steroids, are lowered. SGH is common and appears as small, raised, whitish-yellowish bumps on the skin, especially on the forehead, nose and cheeks. It does not usually need treatment. Fungal infection in the nails can make them become discoloured and thickened, and usually affects the toenails first. Fungal infection in the skin can appear as scaly, itchy patches between the toes or on the feet, in the groin and on other parts of the body. Pityriasis versicolor is a form of yeast infection in the skin and usually affects the chest and back with patches that can appear pink, brown or pale. It may be scaly and itchy. Cold sores are due to the herpes simplex virus. They are most common on the lips and nose, but can appear anywhere on the skin and may appear more often and more severely after a transplant. All these conditions can be treated with creams, shampoos, and on occasion, dependent on severity, tablets, including antifungals and antivirals.
Chickenpox and shingles are caused by the varicella zoster virus. If you develop shingles after transplantation, it may be more severe. Shingles is due to reactivation of the chickenpox virus and usually appears as a painful, blistering rash on a particular area of the body. For example, one side of the chest, the arm, or on one side of the face. Both are contagious, and people with shingles can cause chickenpox in those who have not previously had it. If you have any form of blistering rash, you should seek medical attention immediately. Viral warts are very common after transplantation and are caused by the human papillomavirus. Some people develop just 1 or 2 warts, often on the hands or feet, while others can develop large numbers that need specialist care. They can develop as warts and verrucas on the feet. They can be very persistent and difficult to treat. Unfortunately, there is no treatment which specifically kills the virus. Treatment options include salicylic acid gels, various creams, cryotherapy, and very rarely surgery. Sometimes, if they're very severe, reduction in immunosuppressive tablets can be helpful.
The second half of this video will discuss pre-cancer skin conditions and the different types of cancer seen after a transplant. Mainly, these skin cancers can be easily treated. Occasionally they cause more serious problems. It is important to be aware of 3 key things. What your personal risk for skin cancer is. This will depend on a number of factors. What these cancers usually look like so that you can check your skin regularly for them and quickly report any suspicious changes to your healthcare professional. What are the possible ways of reducing the risk of these cancers, including sun protection and treating precancerous skin lesions.
The 4 main types of skin cancers seen in organ transplant recipients are squamous cell carcinoma, basal cell carcinoma, melanoma, Kaposi sarcoma. Most of these cancers, SCC, BCC, and melanoma, are mainly due to sun exposure. However, KS is due to a virus, human herpes virus 8. Squamous cell carcinoma is the most common skin cancer in transplanted patients, especially those with pale skin. SCC appears as red, crusty, raised lumps, bumps, or ulcers. Sometimes they may look like warts with a red base. SCC is most common on areas of the body that are regularly exposed to the sun, such as the face, ears, scalp, especially if your hair is thinning, hands, and lower legs. Also, SCC, which are not due to sun exposure, may occasionally occur in the genital area. Transplant patients will often go on to develop more SCCs after the first one appears. They can be tender or painful, and they may bleed. SCC can grow quite quickly, for example, double in size within 2 to 3 months, but this is not always the case. People with darker skin types, such as those from South Asia or African Afro-Caribbean backgrounds, are at a lower risk of SCC, but they may still occur. Most SCC are removed by surgery. Occasionally, radiotherapy treatment may be needed. It is important to treat SCC in the early stages, as very occasionally they can spread from the skin into lymph glands and even internally, and this can be serious. Basal cell carcinoma, or BCC, usually appear as shiny, pearly lumps and are commonly found on the upper body and face, but they can develop elsewhere. Occasionally, they appear as crusty, sore areas of skin that do not heal. The majority grow slowly over many months or years. They almost never spread into lymph glands, but can cause problems by damaging and ulcerating the skin, and for this reason are sometimes known as rodent ulcers. Melanoma is an uncommon skin cancer in organ transplant patients, but it's important to catch it early as it has a much higher risk than SCC and BCC of spreading into lymph glands and other parts of the body and causing serious health problems. Melanoma can grow from a long-standing mole or from a completely new mole. If you notice any change in the shape, size, or colour of a long-standing mole, or if you develop a new mole, you must report this as soon as possible to your medical team. The risk of KS depends mainly upon where you were born. The virus is much more common in parts of Africa, the Caribbean, Middle and Far East, and some parts of the Mediterranean, and the risk is usually in the first 5 years after a transplant. It usually appears as a red, purple, or brown patch on the skin, particularly the legs, and is often associated with swelling of the leg. Some skin cancers quite often go through a precancerous phase and are more easily treated in this phase. It's therefore important to be aware of what these precancerous changes can look like and to report them to your medical team if you're suspicious you may be developing them.
The following two conditions are a sign that you are at increased risk of skin cancer, in particular squamous cell carcinoma, which we discussed earlier in this video. Actinic keratosis, also known as solar keratosis, are red, scaly or rough patches of skin that appear on sun-exposed sites such as the hands, face, ears and scalp. AKs are usually painless, but may be slightly itchy.
Bowen's disease, or squamous cell carcinoma in situ, appears as crusty or scaly areas of reddened skin and is a more advanced form of AK. It is commonly found on the lower legs, hands, forearms and face. These areas can range in size from small lesions the size of a pea to large areas almost covering the back of the hand. There are many treatments for AK and Bowen's disease, which include a number of different creams, cryotherapy, photodynamic therapy, and occasionally surgery. Your personal risk for developing SCC, BCC, and melanoma is higher if you had your transplant after the age of 50, you have fair skin which burns easily and freckles in the sun, or you have multiple moles, you've had high levels of sun exposure in the past, for example, lots of sunburn, an outdoor job, many months in sunny countries, or have used sunbeds regularly. The risk increases the longer you've had your transplant. It's important to be aware of what you can do which might reduce your risk of skin cancer. Sun protection is one way of doing this, as many skin cancers are at least partly due to sun exposure.
Early detection and treatment of skin cancers can also help reduce how serious they are likely to become. Regular examination of your skin can help in this way. Finally, you may be interested in finding out more details about skin problems linked to a reduced immune system, and we would recommend the following organisations and their websites.